This is Dr. Pat Sharp, and today I'm going to be talking about something that's definitely of concern, and it's escalating in its level of concern, even here in Spokane, Washington. I'm the clinic director at Neuroeducation, and we've been treating teens and adults and children for depression, among other mental health issues, for 41 years. So I've got quite a bit of experience with this. It's on the rise, and that's not good news. That's kind of a statement about our culture at this point. If you backed up to 2005, only about 9% of teenagers were diagnosed with depression, and nowadays it's more like 20%. So that's a huge jump. That's more than double. The other piece that's very crucial to keep in mind is that depression increases the risk of suicide in teens by about 12 times as much. If they're depressed, they're more likely to think about suicide. And they're at an age where they can actually accomplish that, and that's very distressing kind of information, I know. Back in 2015, which is now 2 years ago, about 3 million teens across the United States, aged 12 to 17, had at least one major depressive episode, and many of those 3 million more than one major one. The other fact that's steady through the ages, through time, is that depression hits teenage girls about 3 times more often than it does boys. They're much more likely to experience depression during these tumultuous years. The causes of depression are multiple, like a cause for anything else, and nothing's a straight line kind of factor in it. There is a piece that it is genetic, but if you yourself as a parent of a child that's a teenager have suffered or been diagnosed with depression, it doesn't automatically mean that your teenager is going to be depressed. And that gets tricky when they go through some of those typical teenage mood sort of swing stuff, and you think, oh my gosh, I hope they're not getting depression. They probably are. And it's just keep an open mind about it, keep aware, keep talking about it. And then if you're really concerned, go get it ruled out or ruled in, so then kind of what to do. How much of this is normal developmental stuff and how much of it is a concern, a real problem. It can more likely than not be environmental. It's something that's going on in their world. And of course, you're probably not among this, because families that are dysfunctional, typically there's much more depression, along with several other mental health disorders in those kinds of families. But you wouldn't be reading this if you didn't care and weren't functioning correctly as parents. The biggest thing with the teen years is the peer relationships, because at this point, their relationship with their peers is far more important to them than it is to be in their relationship with their parents. And that's a normal sort of shift. But it can be devastating when the peer relationships are not supportive, not encouraging, not positive. And we know that, that's often a big problem and leads to depression. And the number one things there are issues around bullying and or trauma. And trauma can be emotional trauma, not necessarily that they've seen an accident or seen some horrible crime committed. It can still be just an emotional trauma. And not all environmental factors will lead to depression, but there is a likelihood there. Now, in a general sense, if you wanted to look at it, there's just, in our day and age, in our culture, there's way more stress. And it's everywhere. It's in the news, it's on television, it's in their magazines, it's in their texts that they send each other nonstop. And it's also the lifestyle that we have now, where there's very little there's very little community sort of support or family support sometimes, because everybody is so busy. There's less exercise for these kids unless they're involved in some sport at school. And then on the other flip side of that, they don't have any unstructured time to just hang out. And when they hang out in their room because they're trying to figure out, who am I and who do I want to be, oftentimes parents get very upset and very distressed by that, because they think, oh my gosh, you must be depressed because you're in your room all the time. And yes, it can be true, but that's not all true. That's not the only reason why teens want to be alone and stay in their room. Poor diet can certainly also play a role in depression as well. It can all set the stage. Okay, so how you can help your teen, that's the important thing that we need to talk about. And the first thing is if they are admitting to you that they are unhappy, unduly sad, can't seem to break out of it, take it seriously. Don't say, oh, you'll feel better tomorrow. I mean, if this is a repeated kind of complaint that you're getting from your teen, listen to them and start doing something about it, which I'll talk about next. But for heaven's sakes, don't blame yourself. It isn't something you did wrong. It isn't even something that your child did wrong. Depression can just come for absolutely what looks like no reason whatsoever. And if you don't get it treated, it can become a lifelong problem, which you really don't want to have. No one wants to have this black cloud over them for the rest of their life. And for serious depressions that do last well into adulthood, it usually first presents itself in those teen years. So pay attention. This is worth looking at. But don't panic, because 80% of teens with depression who are treated and have supportive parents do recover. I mean, the success rate is terrific. There's no reason to not go get help. And there's many very competent and capable mental health counselors and psychologists in your community as well as here in Spokane to help with this. Another factor for parents is you want to try and learn as much as you can about depression. So there's lots of good resources. I'll be mentioning two, I thought, really, really helpful good books towards the end of this little presentation. So the big thing is when you're talking to your teen about depression, make sure you let them know that it's okay. It's not, you're not bad. You haven't done something wrong because you're depressed. And kind of stress the point that, you know, our family, you included, you're in the team, we're on a team, we're going to help you get better, we're going to do whatever it takes. Talk frequently with them, encouraging things, but make it be relevant. Like, don't make things up, because they'll know that you're just saying things to make them feel better. So make it authentic. And know that they probably won't want to talk to you. So make it really low stress. Don't fire them with a bunch of questions. You know, it's more open-ended things would be much more helpful. Like, so tell me about, you know, and then anything about how Melissa's doing or how somebody else is doing, or, but not as general as tell me how school was today, because that's like, well, nothing, right? You know that one. Don't be afraid to ask your child or your teen, are you thinking of hurting yourself? Because you do need to know in order to keep them safe. And if they are thinking of hurting themselves, then immediately call for help. Call the first line for help in your community, or call your doctor's office. Make sure you get other people to help you at this point. And be patient. It won't go away in a day. And there'll be ups and downs. It's going to be a bit of a roller coaster ride where you think, oh my gosh, it's getting better. And then something will happen and you think, oh my gosh, we've lost all that ground. Well, you didn't lose any ground. It's just the nature of the disease. But the good news is, the really good news is that treatment does work, and it can work, so there is hope. These are two books that I think are just really good in terms of helping you help your teenager. The one is Knowledge. It's called Knowledge, Rescuing Your Teenager from Depression by Norman Berlinger. And the second one is Depression, A Teen's Guide to Survive and Thrive by Toner and Freeland, and they're both PhD psychologists. So those two books can be really helpful. CBT, or cognitive behavioral therapy, is the best probably psychotherapeutic avenue to look into, finding out if someone offers that. And then possibly you may need some medications on board, but not necessarily. But keep an open mind about that. You want to do whatever it takes to help your teen feel better.